So I know we have a few new users on with us today and some folks who've been using the system. So I'll briefly go through just how the system's structured, et cetera. And then we really are going to focus in this staff training on getting ready for clinic and operating in clinic so that you are well versed in working inside clinic. And again, suggest that if any of you, we're not a big group, so I want to make sure we get to your questions. Go ahead, put your questions in the chat if you have some today, and I'll try to manage that as we go through. Write a number of items in the inventory. That's terrific, and how it's packaged. We'll certainly talk about that. So thanks. This is a multi-state training. So I'm using today our Maryland staging site. Yours may look slightly different. Don't be alarmed, but the basic functionality is the same across all. So let's first talk a little bit about how PrepMod is structured. Many of you may be aware that we structure PrepMod first by the site. In this case, it'd be Maryland, but it could be a county if you're a county jurisdiction. And then by the individual jurisdictions within, so different counties. By clicking on any county, you then see the organizations that are listed under that county. Each, and they have a 5-digit code that is nested under this 3-digit county code. When you click on the name of any organization, you then see the venue locations. And by venues and locations at PrepMod, we mean clinic locations. If you are a venue admin, you will be assigned different venues. If you're a staff person, you're assigned through your user access to work at different clinic locations / venues. If you're one of our admin users, you can add new, meaning provider employers or a local admin. You can add new clinic sites right from this button and add in the basic information. But as you see, the system nests everything under the counties down to organizations, and under the organizations, each of those clinic locations. Where this comes into play is under our users. If you're a user in the system, you're assigned to work in certain counties, under certain organizations, and at certain clinic locations. If you come in to look to work at a clinic and you do not see the clinic listed, it's likely that you don't have access to work at that clinic, and you will want to get in touch with your organization to make sure that you're added as a user. They should be doing that as they set up the clinics, and we'll talk about that a little bit. And that in adding or changing users, it's easily done but through this edit button here, which you see here, where you can go through and edit someone's use. If you're a lead staff or venue admin at this training, then, and you want to find out if somebody's already in the system, those that roll up under your access use will be available for you to see by searching by name or email, or even by a particular role. These are all the different roles that are in PrepMod. Staff are our vaccinators, lead staff are folks who may be managing clinics. School nurses cannot work in clinic, they have more of a view access, and venue administrators can add staff to work in those clinics. Provider employers are usually associated with a particular organization. I'm going to add a few more people. Whereas our, as we were talking about our things, our local admins are usually in charge of an entire jurisdiction. Okay. Any questions about users? Terrific. Okay, so let's switch to inventory. And we always start our trainings with inventory because you can't run a clinic unless you have your inventory. I'm going to go ahead and admit some. Terrific. And someone had a good question in here on vaccine day. If I'm able to get an extra dose, how do I document that in PrepMod? So let's talk about this inventory management in PrepMod. This page is really divided into two parts. The top is where we add new inventory, and you do have to be an admin user to do that. So if you are a one of our venue admins, local admin, regional, et cetera, you can add inventory to the system. We'll talk you through that. Getting ready for clinic, you need to make sure that your inventory is in the system. The second half of the page is our search function, and you can search by any of these filters. An easy way to do that sometimes is to go in here select a county, an organization, and you can stop there and see everything that is put in at that level. Or if you're working at a particular venue, you can also look and say, what vaccine has been put in against my venue? And again, you'll see by your access level what you're able to see. So if we go down and we see under the configuration we set up, that county, that organization, and venue, we see all the vaccine that's been put in over time and who put it in, what was the starting quantity, and where does it stand. Within here, there's some really handy things that are good for you to know. If you want to see who is planning to use this vaccine at any given time, you can click on the item name. When you do that, you see where that vaccine has been checked out to be used. So in this case, for a clinic on the 28th, 100 was the starting quantity, 5 were actually used at the clinic. Same at this one, and 1 was used, which gives you your final. When is this decremented? It is when you save and submit to the IIS and to PrepMod at the end of a clinic. That's when the total amount comes off the total for the vaccine. I'm going to go back to our main page here. If the vaccine has been put in at an amount, say 40, but you find that you actually have a more vaccine than you anticipated to that, whereas if you have an extra dose from the vial, you can go ahead and increase that number to say 41 or 42, whatever you receive, by hitting the edit budget button. And when that comes up, it's going to show you what you originally put in, and you can increase the number and just update there. Okay. Terrific. This one was asking for a VIS date, and that's why it's asking me to update that. Let's just put one in there. Okay. Terrific. If you have to add new vaccine, so if you're a venue admin and have those privileges, first thing you do is go to the vaccine name. We admit a few more people. And welcome to our new folks joining. We're talking about inventory management. So here you go, and you can put it in by the type, like influenza, COVID, etc. And if you do that, everything will come up that's in the system for you, from which you can choose. Or you can actually go ahead and put in the vaccine type. Once you click on it, we've preloaded some of this information for you, including the emergency use authorization for that vaccine. And then it's up to you to go in and put in the information. They look at the lot number, whatever that may be, the expiration date, which is really important, and make sure you're always making sure this goes in correctly for you to match it to your IIS. That needs to be accurate. And then the number of items. So one of the questions is, what does this mean? Sometimes people say, well, number of items, is it number of vials or number of doses? Please check with your administrators. That's really up to them to decide. Many of them use it by doses so that you can decrement adequately in your clinics, but it's always good to check. How is it packaged? Depending, again, I would reach back to your administrators of your area, whether it be the local health department or your organization, to see how they are putting that in, whether you're receiving them by the box, etc. Source of the items, same. Then the important is, as we talked about how we're structured in PrepMod, to go ahead and put in the structure here. Okay, so we want to look at that by county again. Once I've picked a county, by an organization, and then from the venues, how am I putting it in? If you only put it at the organization, down to the organization level, your venue admins cannot see that. So it's really important to do that. Okay. Terrific. There is this box here that says information sheet. You don't have to worry about that because when we preload in by vaccine name, we are attaching, in the case of COVID, the emergency use authorization. In the case of influenza, other vaccines, their VIS statement. Any questions about vaccine? I'm just looking at our chat, not seeing any, but I don't want you to hesitate to ask. If not, let's get into getting ready for clinic day, which is important to you as our staff who are essential to what's going on. So we can go over to clinics here. There are three important things that are essential for you to do to get ready for clinic. Add in the staff that'll be working the clinic, add in the inventory, and make sure you download your registration list. So we're going to look up the clinic we're going to be using today, which is in Apple County. And as you'll see, there are 4 different ways I can search. If I say all, it's every clinic that's ever been put in the system by my search criteria. Upcoming is from today and forward. Past are those clinics that have already happened, but they've not been closed and the information has not gone to the IIS. And closed means that they are completely done. So let's search on upcoming. All right. So we're going to look at our clinic that we have here on 4-1. To get ready for clinic day, let's go to view and edit. That's where we add staff and we add inventory. Now there's several ways a clinic can be set up. When this clinic was created, it was chosen as a COVID-19 clinic, which means all the health questions that people who registered for this were related to a COVID-19 clinic. If it said flu here, they may only have 4 questions asked of them because they're flu questions. They then had to pick what type of clinic they were doing. A public clinic means that when the clinic was created, it would show on a public page and anybody could sign up. A private clinic means that a special URL was developed for that clinic that was shared among many patients so they could go in and sign up. A private open clinic, if you see that designation, you need to look for that under the all button because that does not have a specific date. So it's not in our upcoming, but it will be at the end of your list of under the all search criteria. And it's a complete walk-in, no date, no time, but it is used, congregate living situations, etc. And invitation clinics is where you're uploading a list of patients. They've all received a unique one-time use URL just for them. So in this case, we set this up as private. They made a decision about whether insurance was collected. They said it was COVID-19 and who they were targeting. And this information is helpful in the search on the public pages. And they decided that this was happening in Apple County under COVID care and at this venue or clinic location. And they put in their setting. The clinic's running for this long. They knew that each encounter length was going to be about 10 minutes, and they knew they were going to have 3 vaccinators. So now we're getting ready for clinic. It's time for us to put in that staff that'll be working. When they set this up, they also said, look, we're going to make our deadline the day before. This can change. If the clinic fills up, you can make that earlier. But when this turns off, registration is at 11:59 on the date. So right before midnight. So if you find that registrations are full and you want to stop registration, people coming and finding that there are no appointments, you could go ahead and make this an earlier date, but know that when it ends, it'll be at 11:59 that night. This button's important on this page because when this is turned on, even though we closed off registrations on the 30th, on April 1st, they're going to turn back on if this is checked. It allows registration on the same day. So make sure you're aware of that. And then we also have a function where you can decide if you want people on a waiting list or not once you're full. We always say when setting up clinics, it's really important that we put in who is the person that people can contact for the clinic. So we hope that when you're going into your clinics, you would already see this. And additional details is something that can show on a public page, enter the side door, wear your mask, etc. Then it's really important that we have staff put in. And if we know we're going to have 3 appointment slots and we want to have 3 vaccinators, we go ahead down here and put in our staff. These are our vaccinators, and we put in the credentials. To add more, we have a button here. You can add as many as you want. If you want somebody who's just going to come in for lunch, go ahead and put them in. Once these are in and we start vaccinating people in clinic, we'll have a way to record who actually vaccinated them. So this is really important for us to go ahead and put in this information so that we're ready to go for clinic. Okay. At this clinic, they decided they're going to have both type of vaccines offered, both Janssen and Moderna. And they went in and decided to go ahead and put in the inventory when they created it. If not, you need to come in and make sure that the inventory is added and that the number of items is put here. If you don't have that, you can't vaccinate people in clinic. Don't be too concerned about these numbers. They're recording at what moment did when I put in this vaccine into this clinic, at what moment, at that moment, how many was the total number and available? And it also gives you an idea of other people who may have checked out some of this. What's the latest? So in this case, when we added this vaccine in, it was at 200. But the latest was that we checked out 80, but somebody else checked out some as well. Okay. You know what vaccine you're bringing, so it's usually not a concern. You could go here and say, I'm bringing that Janssen, but I also want to bring others. And by doing that, you can search in a couple different ways. You can search by the lot number, or you can search by the name. If I'm searching by name here, and I want to make sure I have lot number BC 124, I can go ahead and click on that and say, oh, does this match everything for the clinic that I'm having? In this case, it doesn't, because it says the organization's Allegheny Health Department, and I know that my organization was COVID and my venue was AA-C. So I know this is not the correct one. So let's say, okay, well, I actually think that I know that my vaccine that I have in front of me has a certain lot number. I can see right here if that lot number is present below, then I can go ahead and put that in, and it's going to pop right to the top, and I can click on it and then see if that's the right vaccine. If it is, I could go and add that. One question we sometimes get is, can you add more than one, say, Janssen vaccine? Yes, you could do that if you chose to, because you may have 6 doses of this particular vaccine with this lot number and expiration date, but you may need to add another, say, 20 of another lot number. And so both can be there and both will show up when you go to vaccinate people in this clinic. So I'm checking the chat, not seeing many questions. Here's one. If I amend the used doses in an inventory, how can I reconcile patients that were vaccinated using the wrong inventory? That is difficult. And I'm just checking, if I add extra dose in the inventory manager stated, do I need to adjust the number of items at the bottom of the view edit in the clinic? So two different questions. So you amend the used doses in an inventory, but how can I reconcile the patient? So when you amend it, if it has the same lot and expiration, what are you amending? If you don't mind putting that in our chat, that'll help me answer your question. So you've already vaccinated people with the wrong. We had a case this week where the wrong expiration date was put down for the vaccine that was added to the clinic. So it was added, people were vaccinated, but they realized that they had the wrong expiration date. When they went to inventory management and updated it, automatically updated that in the clinic. So let me know if that answers your question. If you add an extra dose in inventory management, as I noted that you could do you need to adjust the number of items? Well, here's where you would. If in this clinic, let's say you've used your 150 and now you find that you have a few extra doses, and so you really could go ahead and vaccinate 2 more people, 152. I do believe in order to add those to those 2 new patients, you will need to come back to view edit, make this number 152 in this case, and we're going to say it's greater than the current inventory. You can override that. If you know you have that, don't worry. You can update. Should allow you to go ahead and update the clinic regardless, because you know what you have in clinic is why we allowed you to go more than what may appear that you should. Any other inventory questions? Just double checking to see if any other have come in. Great. Super. So we've done the key things we need to get ready, right? We've added our staff in and we've added our inventory. The third step that we suggest you do is to download your registration list. Why do you do this? What if the internet goes out? You want to make sure you can still vaccinate folks, or say the power goes out where you're working. Want to make sure. So the registration page has a lot of information on it. It shows you the number registered, how many are in the waiting list, and approximately how many available appointments are still available. Now, this available appointments shows how many have gotten through registration, but it will also show, it also subtracts from the total number that were available those that have held appointments and it might be in the middle of registering. So if you're ever wondering why the numbers don't appear to add up exactly as you may have available slots at your clinic, it's because you may have a number of people who kind of locked in a time but aren't through registering. Okay. So available appointments may vary a little bit because not only takes the number that are registered, but also those who've locked a time and are getting through the registration process. And since it takes both of those into account, it may be a little bit less than you expect. So the information that you see below, if someone is in bold, it means they answered yes or I don't know to one of the health screening questions. And you can go right here and click on the questions to see what they answered. In this case, they said they had a chronic condition. So that may be something that you'd want to discuss with them at clinic. If they say this upcoming vaccine is going to be their second, over here you can see what they received the first time. If you wish to email them a reminder and it's an individual person who maybe called your office, go ahead and do so by clicking on their name. Everyone should receive an email reminder 24 hours in advance. If you click on this button, these in gray will light up, whether it's an individual person or everyone. And in that case, you could send everyone an email reminder. Select all to do so. You can also view all their consents if you choose. And afterwards, if they say they did not receive their vaccination record, which should automatically be sent at the end of clinic, you can click here to do that as well. Okay. If you have someone on your waiting list, you can download the waiting list here, or you can go and see them under this button. And in that case, if you have an open appointment, you can click move to move them into the appointment, or you can click invite to invite them to schedule themselves. So now that we've downloaded our registration list, we're ready for clinic. Any questions on this page? You'll see that there's an add more patients button. If you're working in the office, you may have somebody calls and says, I don't have access to a computer. And what you can do at this point is come to the registration list for the clinic that you wish, and you could manually add them by clicking this button. That will take them through the registration process. A question came in. Can the first or second dose be changed if it's incorrectly input during registration? It can't because health questions can't be changed. But if you're vaccinating this person, you can make a note within PrepMod that they answered that incorrectly. That information, whether they say it's their first or second, is really for you as the vaccinator and for the planners of the clinic. It does not go over to your IIS. Just their vaccine from that day goes over to the IIS, and the IIS should already have their first dose if they've already had one. So I hope that answers your question there. Let's go over and see what we do on clinic day. I can tell you where you can note that. So for staff coming to work clinic, you're going to come to the home page. You're going to see this. This functionality is available to all our admin users. Every person in PrepMod has a unique ID and password. If for some reason you forget yours and you're logging in, use your email address and click Forgot Password, and you'll receive a link to your email with directions to reset your password. But when you come in, you're going to come to this home page. So here we want to go to Manage Clinics and Users. I have a big menu up here because I'm a super admin user. Whereas for you, you probably are not going to have as many of these buttons, but we will talk about some of them as we go through here. You're going to come right to clinics and you're going to look up the clinic that you've been assigned. If you're a lead staff person telling other staff to come, it's not only good to put maybe the county or maybe the venue name to give them, but also give them the clinic ID. So if there's a number of clinics at the same site, as you see here, they can also look up by clinic ID and date. So if you're a vaccinator and you come right to the clinic activity page. So what's on this page? At the top, this is really for our lead staff. It's for them at the end of clinic to make any notes they'd like about that. Now, this shows to people on the public page. You don't want to put in this information until the clinic is ended. Okay? You're going to see the vaccine you've already put in here. And as lead staff, they will put in the unusable doses at the end of the day. As vaccinators, don't worry about that. Same here. As vaccinators, don't worry about the save or the save and submit button. They're for lead staff or whoever's the lead at the clinic to submit at the end of the day or to save throughout. So what does save do? Saves just saves the information back to PrepMod, but it also sends a notification to those who've already been vaccinated at the clinic with their vaccination record. So if you ultimately might need to make a change in somebody's record and you don't want to go ahead and submit it to the IIS, but you are ending your clinic and you know you're going to do that later, save is a great button to use. Save and submit does 4 things. It sends those notifications to those who are vaccinated, saves it back to PrepMod. It also closes the clinic and it automatically sends the information over to the IIS. PrepMod is really set up as an enterprise solution where the individual puts in their information, everything from their demographics, health, screening, through consent, so that you as staff just come in and work here. And then by hitting save and submit, it automatically goes to the IIS. If somebody hits this incorrectly during the day, they're going to get a reminder message letting them know that there's a problem. If they hit yes, it will close the clinic. If that happens, don't panic. Come up here to clinic status. You'll see it says closed, and there is a reopen button that will appear. For staff coming in, vaccinators working the clinic, you're going to live right down here, and everyone uses the same view. So everyone's working in the same database here. If we need to add a patient during the day, we can do through this button, and we'll talk about that. So if you're coming in, it's a big clinic, 100,000 people, and you want to make sure that you can find your person easily, you can come right here and just type their name. And by searching on Grace, I'm just going to see Grace's name here. And that makes it easier for me to make sure I'm hitting the right button for Grace. Someone just asked what that save button means again. I just want to remind you. What save means is, of course, saving it back to the system, but it also sends a vaccination record to everyone who's already been vaccinated. And I'll talk about what might be a case where you don't want to go ahead and send that over to the IIS yet, because if Grace Carr comes and I'm vaccinating her and she mentions, when I put my birth date in, it was wrong, you're going to need to be able to go out and make an edit to that. And we'll talk about that in a little bit. But right here, Grace has come. I've gone through my normal vaccination process. And at this point, I'm going to go ahead and record that. Now, if she refused, I just would hit this button. If she was sick, if she was absent at the end of the day, I'd note her as such. No one can be deleted, which really means their appointment is canceled if they've been marked positive in any of these buttons. So if you click them as absent, you can no longer delete them. Okay? But we've vaccinated Grace. So we've marked her as absent, but actually we vaccinated her. So we're going to come to our form. To start that, I click on which vaccine I'm giving her. I note the route, the site. I need to put in if she had any reaction, no. And I want to make sure that everybody slides this bar, because in some instances, there may be additional information for you. Want to make sure I have the right date. Well, today's the 25th, so that's not correct. Want to make sure I put in the right date. So that goes into our IIS, right? Coming back. This general reaction is usually applied when someone maybe has waited their 15 minutes. If they end up having some reaction at that time, somebody can come back in and click on the reaction that they have. At this point, we're going to say none. And now I'm going to select my vaccinator. In this case, I'm going to say it was Ironman. Now, this is Grace's first vaccine, so it did not complete her series, except she had Janssen. And in this case, it did. So I'm going to say yes, because the type of vaccine she had, this completes her series. I mark her as yes, and I update her record. If I've already had something in before, it's going to say, the encounter's already been documented. Are you sure you want to change it? I'm going to say yes. And now her radio button shows as vaccinated. Let's go get our next patient. I hit reset. You're ready to go. This is either by their first name or last name that you can search here. Okay. Now you see Grace is done. So if Grace mistakenly told me something, let's go down to somebody. I think your question was, what if somebody says this is their second, but it actually isn't? How do you remark that? I could go ahead and to Daisy, I could go ahead and go through the process of putting in all the information for her. Make sure I have the right date, as we said. And go down and note there's none. Put my vaccinator in. And in this case, if let's go back here and vaccinate. She's having Janssen, then yes, we'd say yes. Let's go ahead and update that because it completes her series. I'm updating her. The system takes a second. It's saving that information. But it remarked that she had already had one before because it said second. So I may want to put a remark in here. Didn't receive an earlier dose. Now, in your IIS, it would note that anyway, right? Because if she'd had a previous dose, it would show in the IIS. I'm going to go ahead and update that. This message is only saved within PrepMod. Okay? So just something good to know there. You cannot add remarks for the other buttons here, just under vaccinated. All right. Any questions we have? Not at this time. So as a vaccinator, you're going to go through the process all day. What if somebody comes in and tells you that they misspelled their name or their date of birth is wrong? If you are a venue admin or one of our admin users, you can go to record search and change their record. If you're a vaccinator, make sure you write that down and that you get it to the lead person. They will not want to save and submit until that has been changed so that they make sure it goes over to the IIS correctly. So I was saying they may just want to save at the end of the day if they need to go back, find an admin to make those changes. Lead staff eventually will have that opportunity to do those edits, but they do not currently have that functionality. So sometimes people come up to a clinic and they say, I'm here. And you say, we don't see you. You put their name on the list and we're not seeing them. It could be that they're confused because if you're having a clinic at the same place Monday, Tuesday, Wednesday, Thursday, maybe they had their dates wrong. And I was at a clinic where this happened. So what we did is we went right up to record search. Let's look for Daisy, keyword Daisy. I could put in the whole if needed to. I'm going to search on that. I'm going to see there's a number of Daisy Ducks who have records in here. And each time someone does register, they do get a new record. If I want to see if Daisy already has an appointment, I can click on her name. If I need to change something about Daisy's information, I can edit it if I have those privileges. Who has those privileges? Our admin users. So if I'm an admin user, I can come here. I can say, well, she actually has a middle initial of A here. And I could change any other information I needed. What's here is demographic and insurance only. I can save and continue. Okay, so I've updated Daisy. If I just want to see if Daisy has an appointment, I can search and go to the name as I explained. So we've already updated her name here. I can go here, her basic information shows up, and then it says, oh, she actually has an appointment on a waiting list at this location. If she's already been vaccinated, let's go to our record search and we find the Daisy who was at our clinic. And I don't know that we'll be able to find her that quickly, but let's look here. Maybe this could be her. This person actually has an appointment, but it's at a different date. And so this is not our patient at our clinic today. But if so, all of the information that she received would be down here. And if I had put in any remarks, they'd show right here. Okay. No questions? Let's keep going through. So we've talked about what you do in clinic. If you are a lead staff person and you at the end of the day hit save and submit, As we said, that's not really for our staff to do. You can go to data transfer as well as all of our admins to see that the information has gone over successfully. This is a test site, so we expect to see all these errors. If there is an error, you can look here and it'll tell you what did not go over correctly and whether it failed. Okay. And at that point, you can get in touch with your IIS or anyone to know. After clinic, if you need to get in touch with folks, there is a message center that's available at our admin levels and lead staff. You can get in touch with people in advance. All registered means everybody has appointments and is on the waiting list. Confirmed have appointments, waiting list, self-explanatory. And after the clinic, you can get in touch with those who are vaccinated. If you want to tell them about a second dose appointment, send over a link to an upcoming clinic, etc. And you do that by selecting the right clinic here. And you can search by the clinic name or the county to see all of those and put in that information, for example. And then you can create a message and send. That's the primary functionality that we've been through. Want to make sure that you're clear on, logging in, getting to your clinic. As I said, if you come in to the system and you go to look under clinics and you don't appear to have the access to that clinic, if you look up Apple and you're not seeing anything, that means somebody needs to update your user access. People who can update access they can only update to people who report under them. They cannot update the access of someone at the same level. Okay. Terrific. Well, we've been through most of everything today. I do want to let you know if you're working in this system and you have a question, we have a help number at the bottom of the page here. This is only for tech support, never to be given to the public, so that we make sure we're available to answer your questions, or you can email us here. These are new numbers as of this week so that the public is not coming to the number anymore. We had people posting that number everywhere, so we've done that. And so this is available for you to help. If you're wondering, you have people working in clinic, you want to make sure, or if you want to answer a question, the training materials is on everyone's menu. When you go in there, this in-clinic handbook is very helpful to you to be able to go in. There are about 5 pages in here that really talk about working in clinic. So if you have somebody who wasn't able to join us for this clinic training, you can see that there, as well as who has access to what functionality within the system and some other quick start guides. Okay. Thank you so much for joining. I'm happy to answer any other questions you have. Don't see any at this time, but want to make sure if there are any, we can cover that for you. All right. Thank you again for joining us. I think I want to make sure somebody says, is the training tomorrow similar? The training tomorrow is our admin training. It's going to go into a lot more detail about managing the clinics, but it does go over some of this basic functionality as well. It's just a little more in depth for those admin users. All right. Thank you all so much. We'll give you back a little bit of your time, and thank you for all you're doing in our community. Your work is so valuable and we appreciate it. Thank you.